Hi, my name is Tara Wood, and I am here to talk to you today about my journey to the NICU. Originally, I never set out to be a nurse. My plan was to be an elementary school teacher, and during probably, I guess it was my senior year, I was already in rotations in college to become a teacher, and I was married and happily expecting twins, and unfortunately at 26 weeks and 2 days my girls were born, and that changed everything for me. The girls were in the NICU, obviously, and I was 23 and really had no clue what was going on. I picked my hospital because of the wonderful LDR suites that they had newly built, and was very excited about having babies. I never thought to look to see if the hospital had a great NICU, and it was one of those things, in looking back, how I wish the NICU would have probably been the first thing that I looked for in a hospital. But nevertheless, we were fortunate enough that they had an amazing level 3 NICU, and the girls were born weighing less than 2 pounds and spent 87 days in the hospital. And during that course, I clung to every word that the nurses and the NNPs gave me, whether it was support, hope, or realism, or just a friendly word of encouragement regarding pumping and breastfeeding and skin to skin and all of the wonderful things that they let me be a part of in taking care of my babies. They really inspired me, and following the girls' discharge from the hospital, I came home, and there was this gnawing. I call it a calling now. I know it was my calling to belong in the NICU and to be able to give back, just like those NICU nurses gave to me, hope and support, and just translating all of the pumps and beeps and monitors and updates, and just being that guide through that journey. It was so inspiring and very much needed, and I wanted to be a part of that. So with a lot of discussion with my husband and my family, I made the decision when the girls were 1 to return to college, but at that time my major was changed to nursing, and I set out on a path to become a NICU nurse, and I did. The girls were 3, and I graduated, and immediately got a job in the NICU, and I began to minister to families from my own experience. So when I was watching parents hurt, I could give them that friendly pat on the back and let them know that I knew how they felt, and I truly meant that. I knew exactly how they felt. And it was important that I could sit down and have a discussion with them and look at them eye to eye and understand their pain and their suffering and what they were going through, and help them navigate their way and through their journey. During that time, I felt inspired to continue my education and went back to school to become an NNP. I wanted to just do more and learn more of the actual creation of management and treatment plans and be a part of that process. And as much as I loved the bedside, I loved being able to navigate the NICU journey from a different angle. And it still allows me the opportunity to be able to speak to families, update families, educate families. I do miss the one-to-one bedside contact that you have as a nurse, and that is something my heart often longs for. But I do get to see many more families in the role as a NNP, where I'm updating most all the families in the NICU unit at this point, and that brings great joy. I'm also able to share the good news of my girls and their journey and their long-term outcomes, which we all know isn't always positive, but it's definitely encouraging to hear something positive and to see that the outcome doesn't have to be so grim, because in the beginning you're given a lot of statistics as a parent, and you do see lots of tubes, and you don't see your baby as that newborn who's healthy and 7 to 8 pounds that you expect when you start out on the journey of pregnancy. So it's always good to see that there is hope. And with our technology and all of the great medical advancements, there should be lots of hope, but a lot of realism and caution as well. I'm currently now teaching the neonatal nurse practitioner track at UAB, University of Alabama at Birmingham, where I'm able to use my journey to teach future nurse practitioners and hopefully give them a little piece of my own perspective, so that when they are out in their own NICUs, that they're able to provide a different aspect. For many nurses, they may not be touched personally in the specialty that they work in, but if they know someone or have a personal story that they can look back on, I think for all of us, we have a loved one who has went through something, and it changes us, and it changes the way we look at how we provide care to our patients and families. And to be able to work with a calling and work with a perspective that we've all been patients and families of sick loved ones, it really makes a difference in how we provide our care and updates to patients and families. And I hope that my own journey provides a good story for someone else one day. I have lots of babies that I guess now with my journey I've been in nursing for 17 years now, and so I have 16, my babies are my first patients, as I call them. My babies are now driving, and social media gives me a good avenue to keep up with lots of patients and families, and to see my first NICU baby patients driving is amazing. Driving and thriving, and I love to be able to watch them grow through their pictures and updates that parents sent me, and it is a true honor to be a NICU nurse and really feel like I make a difference, and to know that NICU nurses make a difference. And even when the outcomes aren't as positive, to know that you provide compassion and a true sense of support to families, it makes a difference. And I have families that weren't able to bring a baby home with them, but even through that journey, you provide love and support. And I believe that NICU nurses and nurse practitioners are a entity of our own, and we provide so much more than just fundamental patient care. We provide mental health support, and it is a true calling, and I'm honored to be a part of such a wonderful and amazing specialty. And I thank you for allowing me to share my story. And just to follow up, my girls are now 20 years old, and they just completed their sophomore year of college, and I have one who plans on being a NICU nurse herself and sharing her own personal story, which she doesn't remember. However, she has heard lots of stories and memories about her birth and her 3 months in the NICU. And my other daughter is planning on continuing her education to become a mental health child advocate, and I'm very proud of both of them, and I thank them for the direction that they provided me through their birth experience. And I hope that this inspires you. Thank you. To access other recordings and interesting stories and educational opportunities, go to youtube.com/ANNeducates.